Hi, my name is Dr. Daniel Skura, and I am a primary care sports medicine physician here at Seaview Orthopedics. My specialty is non-operative sports medicine, which means that I use various different types of treatment modalities to help return an athlete or an individual back to doing the activity that they love doing without the use of surgery. Today, we'll be discussing staying active while recovering from a sports-related injury. Staying active while recovering from an injury is very important. Being active does many different things for your body. One, as an athlete, it'll help you maintain your physical conditioning, your strength, and your ability to participate in the sport once you heal from the injury. Two, it also helps your body recover faster. It increases blood flow, which means that the injured part of your body is getting more nutrients and oxygen to help promote the recovery process. Third, physical activity, beyond the physical effects that it has on your body, also plays a pivotal role in someone's mental health. It's been shown time and time again that physical activity helps with anxiety, depression, and boosts someone's overall mood, which can help make the healing process more manageable. There are many ways to stay active during the recovery process from an injury. You just want to make sure that you do so safely and in a way that's not going to delay your recovery process. There are plenty of different types of low-impact activities that you can participate in while recovering from an injury. After discussing with your physician, you can figure out which activity is right for you depending on the injury that you're recovering from. Some examples of low-impact activity include swimming, biking, and walking. If you wish to get back to doing an exercise or a sport that you were previously doing prior to your injury, you can do so in a modified way. You want to be sure to not put stress on the affected body part or joint. For example, if you're recovering from a knee injury, it would still be okay to work out your upper body in the gym. A skilled physical therapist will help guide you through various different types of exercises to help improve muscular strength, joint mobility, and even promote overall health. When trying to stay active during the recovery process, it is important to listen to your body. It's also important to avoid putting excess stress on that body part or joint. High-impact activities such as running, jumping, or quick jerky movements such as cutting in football or basketball can increase your chance of re-injuring that body part. Pushing yourself too hard, too quickly while recovering from an injury can set you back even further and delay your recovery process. Making sure that your body is resting enough, especially early on in the injury course, is very important because it's making sure that you're not adding any more injury to insult to the damaged tissue. In contrast, activity has been shown to help improve tissue healing and also have positive effects on your mental health. So it's important to stay active after a short period of rest. Deciding when it's safe to return to activity following an injury depends on many different things. It depends on the patient, the activity, and the type of injury that occurred. Most injuries, after a short period of rest, can be gradually reintroduced as the patient starts to become pain-free. Typically, we don't return a patient to full activity until the patient is completely pain-free in the activity or sport that they're trying to return to. Before you return to any activity, it's important to consult with your sports medicine physician to make sure that it is safe and appropriate for you. My final piece of advice for any athlete who's currently recovering from a sports-related injury is to stay active, but do so in a safe and controlled manner. Before returning to any activity, it's important to consult with your sports medicine physician to make sure that you are not returning to the sport too soon or too aggressively. Everything should be done in a gradual manner, and progression is often dictated by the amount of pain that you're having during a specific movement or exercise.